Hello, my name is Dr. Xiong. I'm an internal medicine physician from Dallas, Texas. Today, I want to talk about a few very difficult to diagnose symptoms, but they're also very common symptoms that I hear from my patients. First, I want to talk about abdominal pain. And in the future videos, I will talk a few other symptoms that a patient would complain to me. So abdominal pain is probably one of the most common complaints I hear from patients. However, it is one of the most difficult diagnoses for me to figure out why patient is having abdominal pain. I have heard a lot of patients come to me saying, "Doc, my stomach hurts. Can you give me some medication? Can you help me?" So a lot of times I was like, well, that's kind of hard to say because there are so many organs in your abdominal cavity. There are so many things that can be wrong with your abdomen. It's very difficult for me to make a diagnosis just by listening to you with one sentence. So what I do normally is, what I encourage is for you guys to think about those things and tell your doctor about it before asking your doctor to give you a final diagnosis. So those are the things I would normally ask my patient. So number one, I would ask them, how long have they had the abdominal pain? The onset. Does it come right away, acute onset, or has it been more on the chronic side, slowly onset? Where is the location of the pain? We usually divide the abdomen into 4 quadrants. Is the right upper quadrant, left lower quadrant? Where does it hurt, right? Does it radiate anywhere? Does it radiate to the back, radiate to the lower abdomen? Does it radiate to your shoulder, have some referred pain to your shoulder? And then the quality of the pain. Is it sharp pain? Is it dull pain? Is it like a burning sensation? What kind of pain it is, right? Another thing I would like to know is how bad does it hurt? Is from 0 to 10, 0 being like no pain to 10 being the worst pain you've ever had. How bad does it hurt? So other than those things, I also like to know, is there anything that may make the pain worse or better, right? So, or is there a certain time of day that you're hurting worse? For example, some people will feel like, oh, I hurt more at nighttime when I go to sleep. Some people say, oh, I feel like it hurts more after I eat. So all those things will help. So even with all those information, still sometimes can be difficult, because there's just so many things can be wrong with the abdomen that can cause those symptoms. So if after all those descriptions, the doctor still cannot make a diagnosis, then we may have to order some imaging, such as abdominal x-rays, CT scan of the abdomen, sometimes even MRI. But most of the time, x-ray or CT scan will help us quite a bit. So in the future, when you complain about abdominal pain, make sure to think about those things and let your doctor know. That will really help your doctor to make the right diagnosis for you. And again, abdominal pain is one of the very difficult diagnoses to give to a patient. If you like my video, please like and subscribe and give me some comments on the comment section. Ask me any other interesting questions you have, and I'll try my best to answer them.